Hi, everybody. It's Sarah. Just a word before we listen to today's episode of the S Word, a podcast about suicide prevention. I just want to note that this episode does discuss specific methods around suicide and specifically firearm suicide. There's also some language that is used in this episode that might be upsetting to some. And so if you are not in a great space for that today, please go ahead and skip this episode or give us a listen later on. Thanks so much and take care. Welcome back, everybody, to our first episode of 2024 of the S Word, a podcast about suicide prevention. I'm Sarah Kolbeck. I am an assistant professor of psychiatry and behavioral medicine at the Medical College of Wisconsin. And I also direct the Division of Suicide Research and Healing at the Medical College. And I'm flying solo today. My co-host, Andrew, unfortunately, is feeling a little bit under the weather. So we hope he'll be back with us next week and wish him the best as he is recovering. I am really excited about today's episode. Our guest is Katrina Brees, and I'll talk a little bit more about Katrina and her work in just a moment. But before we get started, just a couple of reminders for our listeners. This podcast will discuss issues related to suicide and suicide prevention. And so if that feels like a tender topic for you today, please just make sure to take care of yourself as needed. Make sure to do something nice for yourself after you're done listening to the podcast today. And I do also want to remind folks that there are resources available if you are ever concerned about yourself or a loved one. You can dial or text 988 to reach the National Suicide and Crisis Lifeline. You can also text the Hope Line, which is the text crisis line, by texting the word talk to 741-741. Both of those resources are available 24/7, 365, and are free and anonymous to use. So just encourage folks to reach out to those services if needed. So as I mentioned, our guest for today's podcast is Katrina Brees. Katrina is an artist and an activist. I was kind of doing a little bit of research, Katrina, about some of your work and was really interested to see that you're actually a parade producer for the crew of Lassos for Mardi Gras in New Orleans, which is so cool and so
interesting. It's definitely the dream job.
Good. Yeah, it sounds really, really interesting. And your linkage to suicide prevention comes through your work with Donna's Law, which we'll talk about a little bit during this podcast today. But welcome, Katrina. We're so glad to have you.
Thanks for having me on.
Yeah, of course. So you reached out to me, Katrina, and I'm really glad that you did, because a lot of the topics that we talk about as part of our podcast episodes are related to suicide prevention. And one of the kind of mechanisms for suicide prevention is policy change. And so I was wondering if you could spend a little time talking about your background in terms of suicide and suicide prevention. I know that you lost your mother to suicide, and that was really the impetus for Donna's Law. So if you could spend some time just telling us a little bit about your work, that would be great.
Sure. I lost my mom, Donna, to suicide in New Orleans in 2018. She had a long list of medical and mental health issues, and we were very on top of everything. She was experiencing psychosis and impulsive suicidality as a result of down dosing from a medication that she was prescribed as to reduce the suicidality. And unfortunately, that didn't work. And in that period of time when she was down dosing and experiencing these horrific side effects, which were mental and physical, it also caused her to lose most of her ability to walk. She had extreme tremors. So in this period, she was voluntarily hospitalized 3 times, 6 months previous to her suicide,
Mhm.
and had excellent care, the best that is available to anyone, I would assume. And even because of all these things, we were not able to stop her from accessing a handgun.
Mhm.
And we live in New Orleans, where there is almost no gun laws. Like, you could come to my house, I can sell you a gun in my kitchen, it's your gun, then we can go out and walk around with guns, and that's within our rights.
Mhm.
So my mother, in this episodic psychosis, left her house. Her partner at the time had quit his job to make sure that he was home with her all the time and able to supervise her. And she lied to him and went to the gun store and purchased a gun very quickly, and was able to take that gun to the park near our house and shot herself there.
Mhm.
And after that happened, um, I guess anyone who loses someone to suicide, or probably any other kind of death, questions what could have been different? How could I have stopped this? How can this not happen again to
Mhm.
me or to loved ones? And immediately I felt, how could she have had access to a gun when she was just in a lockup psychiatric facility 3 times?
Right.
And because she had voluntarily admitted herself, she wasn't given the tool to create a prohibition against firearm sales.
Mhm.
So she did not have that life-saving tool. And very quickly, I thought, um, how could this be different? How could my
Right.
mom have, who was an excellent self-advocate, who always followed directions from her doctor, who went to hundreds of doctor's appointments, be given another tool that could have saved her?
Mhm.
And so the tool that has become Donna's Law is a voluntary prohibition on being able to purchase a firearm, and it's also reversible. So it essentially puts the power of a waiting period into an individual's hands.
Mhm.
And it has no specific connection to mental illness or any other like, you don't have to be diagnosed. You can just feel that this is a tool that you want, and you can sign up and use it. If you're lucky enough to live in one of the 3 states that currently has it, which is Washington and Virginia and Utah. And I have a partner on this project named Fred Vars, and
Mhm.
he started working on this before my mom died, and about 5 years before my mom died. And this really would have been a great tool for my mom. My mom really hated guns. Our family doesn't have guns.
Mhm.
No one we know is putting guns around us. It could have really worked for her. And I was introduced to him actually by a reporter who was doing a story about me trying to get this legislation accomplished in Louisiana. And within 6 months, I had it in the legislature here, and it was so sadly rejected. And the protesting on it was just heartbreaking.
Yeah.
And I told myself that I could not survive in that atmosphere
Mhm.
in Louisiana and Baton Rouge and the legislature there, and that I would just commit to doing the work in other states where people wanted this tool, and where I wouldn't be abused by trying
Right.
to provide people with something like this. So we currently have active bills in about a dozen states.
Okay.
A lot in the Midwest, hopefully Louisiana again this year,
Mhm.
um, the Northeast, Tennessee, Washington, D.C. And I expect that it'll be nationwide eventually. It's just a matter of how long is this going to take to do the
Sure.
work, and can we do it state by state, or can we do it federally? Last year, we were able to get it into Congress. And then because of the elections, there just wasn't going to be anything related to firearms shown to that committee anymore. So we were just completely blocked out from the ability to even discuss this tool,
Sure.
which is so sad. I mean, this is a public health crisis. Like, people say, like, this is the 10th leading cause of death in America. And it's like, well, this is the number one leading cause of death in my family.
Yeah.
Like, I looked at a family tree over the summer, and every single person in my family that died before 80 years old, it was a suicide.
Okay. Yeah.
And so when we think about like this being the 10th leading cause, there's a lot of families that this is the number one cause. This is generational. And there are a lot of factors that go into it, but truly access to guns is what the final connection is to a death.
Right. Yeah.
And I was thinking about like if we looked at lung cancer, and you asked me, how can we prevent people from dying of lung cancer? And I said, oh, well, we can help them not be smokers. And then we can also help all those secondhand smoke people. But if someone says, how can we prevent suicide? And I say, prevent access to guns. That is so radical and dangerous a statement to say in our country right now, even though the vast majority of the gun crisis is suicides, where we have 2/3 of gun deaths are suicides.
Right.
But that doesn't mean that other third is disconnected from suicide, because we hear all the time of mass shootings ending in a self-inflicted gunshot wound. And it's very common for a man to shoot his wife and then shoot himself. So when we think about what is the problem with, like, what is causing this epidemic within suicide and guns, it's hand in hand. And it's really, I mean, it breaks my heart that it is so controversial to be saying these things, and to have to live in the fear that I have to live in because I want to save lives with a totally voluntary tool.
Right.
Yeah.
Yeah. I'm, first of all, I just want to say how sorry I am about the loss of your mother and of, the losses that you've experienced in your family. I'm really sorry to hear that you've, run into some safety issues as it relates to advocating for this policy. It certainly is a contentious issue. And I think a lot of us in the suicide prevention space and even the injury prevention space, we think about different kind of facets of prevention, right? We think about, the individual and, how can we, maybe address the underlying mental health issues that the individual is having. And it sounds like your mom was getting the treatment that she needed. She was voluntarily admitted to the hospital a couple of times. She was on medication. It seems like and you mentioned that she was a good advocate for herself. So it seems like she was doing a pretty good job of, trying to take care of, herself as an individual and her mental health issues. So the other piece of that then is, the method or the way that somebody decides to attempt suicide, and what can we do in the space of that prevention. And I think that's where a lot of people really get stuck and don't necessarily think about that as such an important part of suicide prevention and firearm violence prevention overall. Is really, there are these tools out here that can be used when that individual is in a crisis situation, that can kind of be a second barrier or a third barrier or whatever it is to prevent that access. that, really has been shown in the literature in the research literature to be effective for preventing suicide. We see in states that have certain policies, we see reductions in firearm suicide and reductions in suicide overall.
Mm-hmm.
So, I think it's such an important tool in our toolbox for suicide prevention.
Mm-hmm.
So could you explain a little bit more in detail about, kind of how Donna's Law works? So you mentioned that a person can sort of voluntarily um, prohibit themselves from purchasing a firearm. So how does that work if a person is interested in doing
Sure. For the individual, they can go on donnaslaw.com and there's a tab there about signing up, and they can look at the specific state that
Mhm.
and the way that the state has created that mechanism. So, for example, in Virginia, one can download a form and provide a photo of their driver's license and send it in without interacting with any humans.
Okay.
In other states, it can be a little harder. My
Mhm.
goal in the work that I do is to make it as easy as possible, and the
Sure.
opposition works against that to make sure that it's as hard as possible once we get the bills through to actually get people to sign up. But it is possible in all these states, and people are using it. And we don't have any education campaigns going other than like right now, me doing this podcast. So the people that are finding it and they really do want it. So it shows me how desirable it is for
Yeah.
people. And so many people have told me that they wish they had that tool at a specific time in their lives. So it's not that hard to sign up. I
Yeah.
personally have signed up in Washington State and Virginia at this point, and I look forward to signing up in any state that will allow me to.
So if I'm understanding, depending on the state, they can go to donnaslaw.com, um, select the state that they're from, and then it could be as simple as filling out a form
Mm-hmm.
and sending it in. And then I assume that form would go to some sort of state level registry or
Yeah.
sort of
So
database. Yeah.
so the way that works is our country has something called the NICS system,
Mhm.
which enables background checks by licensed firearm dealers.
Okay.
So a licensed firearm dealer has to check, and when they call in, like when the gun store clerk calls in to the registry, it doesn't give them a reason. It just
Mhm.
allows or denies.
Okay.
So for people that live in a place where they're concerned about the confidentiality of this list, there
Mhm.
haven't been any breaches of this list. It's managed by the FBI. It already exists for, let's say, like criminals and people who have legally lost their rights to use guns. So we're using the same exact tool, the same, pretty much the same software, the same people to allow a voluntary option into this
Yeah.
system.
Yeah.
And
It's
it's also
Go
it's
ahead.
completely free, which is cool
Yeah.
because not all suicide prevention tools are,
Right.
and it has no side effects, unlike some other suicide prevention tools. There's no chance of an employer being able to see this. It's completely confidential. We have protections about coercion written into the
Mhm.
bills. So it's a very safe policy
Yeah.
tool mechanism for people to trust to use this for themselves.
Yeah. It kind of seems like and this is my own bias coming in, but it kind of seems like a no-brainer to me, especially
Yeah.
since it's voluntary. So what has been, and I'm going to ask you about kind of successes in a moment, but I'm curious because it's voluntary, because there are protections about coercion, because it's free, because it's integrated into an already existing national system. What is some of the opposition that you've come across as it relates to implementing this bill?
Well, the opposition is pretty similar and run by the same people in all the states, it seems like.
Mhm.
And it pretty much revolves around slippery slope,
Okay.
and that if we're going to start making lists about what the government is going to allow you to do or not, that they don't want more government oversight
Yeah.
on people. I've heard from mental health organizations that in the beginning did not necessarily support it and later on have.
Okay.
And their criticism has been that this stigmatizes people with mental illness, and that's saying that people with mental illness are more likely to commit gun violence
Oh, I
is
see. Yeah.
is against their talking points.
Right.
So a lot of organizations will tell you that people with mental illness are more likely to be victims of violence than to commit violence. And so when we talk about preventing people with mental illness from access to firearms, that is suggesting that they can be dangerous to society,
Sure.
and there could be ramifications about that stigma around every aspect of their lives.
Right.
And not getting treatment because they would fear that.
Yeah.
However, the truth about gun violence is that it's mostly suicide, and suicide is gun violence. And so even though these people might not be the ones likely to commit violence, on others, they are more likely to commit it on themselves, and we know that, and we want to give them the tools to protect themselves. And the whole thing about stigma and the warnings, and like today I was on my social media and I was excited to do this podcast, and then I was like, oh, if I put on Facebook that I'm going to be on the S Word, a suicide prevention podcast, then 0 people are going to see my post because Facebook will prohibit people from seeing the word suicide. So then I made up this new title for the show that was the S Word, an S Word prevention podcast.
I love it. I'm going to have to remember that to put on the algorithm.
Yeah. And it is so ridiculous that it's been so simplified by the tech industry that we can't even talk about suicide prevention, because then we're talking about suicide. I also think it's like, for example, one of the myths about suicide is that women don't use guns and men use guns.
Yep.
And this might have been true in an era where women didn't own guns and all the guns were owned by men. And so there was a big difference. And also we didn't have Google.
Yeah.
And so there are internal corporate policy change
Yes.
that can also be addressed.
Yes.
That are not political. And for example, like, I don't know how this is in other places people live, but where I live in Louisiana, I Googled the gun that my mom used. And then I was shown gun ads no matter what I looked up for weeks.
Yeah.
And I'm showed gun ads all the time because I do this work.
Right.
And it's like, I am not someone that has the mental stability to be shown gun ads all the time.
Right. It can be, I would imagine that is really, really activating, right? Like,
yeah.
And there's, to your point, there's nobody's talking about the need to, I mean, you're talking about it, but, the need to put some sort of control on this, because it's, essentially commercials and ads and things like that for these products, without, I think, any consideration for the potential harm that it can do to folks who are dealing with a mental health issue.
Yeah. And I mean, I love Google. I use it all the time. And so like, I Google everything I'm going to do.
Yeah.
And if I was going to kill myself, I would Google that too. And when we think that women aren't going to do this with guns, it's not true. The amount of women that have guns now is as many as the amount of men that have guns now.
Yeah.
Even though the men have a lot more guns. And the types of guns that women get are types of guns that are even better for killing yourself with. And like I joke sometimes, like, one good solution would be to only have guns that are 5 feet long.
It's kind kind of that, yeah, change the tool, right? Because
Yeah.
yeah,
So, women are Googling this, women have guns,
right.
and most women are dying by suicide, by gun now.
Mhm.
Even though it is more men, it is hugely on the rise for women.
Right.
Like, my mom was not an anomaly, she was an equation,
Mhm.
you
Mhm.
know?
Mhm. Mhm. Yeah. Yeah. I mean, some of the data that I've seen have shown, particularly with women who are veterans, and I know your mom wasn't a veteran, but just the way that this is changing, and I think sort of our conventional wisdom about what suicide is and what suicide looks like is changing as our society is changing and as our context is changing as well. So I think that's a really important point, that kind of what we've always thought about suicide. I think we need to challenge that a little bit and work toward a better understanding to inform policies, whether they're organizational policies or legislative policies that could be a little bit more effective, because I think what we've been doing is it's not doing the whole job, clearly, because we're continuing to see suicides. And so I think there's really a need to think about this a little bit differently. And I think Donna's Law is a really great example of, an innovative way to think about this a little bit differently. And so
Yeah, like you
oh
said,
yeah,
like
go ahead.
a no-brainer.
Yeah.
And like people talk a lot about common sense gun laws, and I'm
Mm,
like, you heard of common sense gun laws? This is a no-brainer. Like, of
yeah.
course, let people voluntarily opt out of it. I
Right.
mean, we
Right.
have gambling prohibition voluntary. We have advanced
Right.
directives. We
Yep.
have medications people can take so that their addictions play with, interact differently and make
Yeah.
them, not get high.
Right.
So we have all these ways that people can ch- choose restriction in the future to prevent, a certain type of themselves to be in the driver's seat.
Sure.
And it's I mean, it's obviously just political that this hasn't gone, further.
Mhm.
And
Mhm.
I was thinking a lot today about you and I've been listening to a lot of your episodes to get ready for this conversation. And I was thinking about how suicide and suicide prevention look at different things.
Right.
So, like, if you ask the cops about suicide,
Mhm.
they will say it's the guns.
Right. Right.
And if you ask a mental health professional, like they might look at my mom and say, oh, well, she had bipolar.
Right. Right.
And if you ask me, I would say there were 100 contributing factors to my mother's
Absolutely.
death.
Yeah.
But the experience of being suicidal, let's say, has a lot of opportunity for intervention, whether that's
Mhm.
medication, therapy, exercise, church, whatever that is for people.
Mhm.
Um, but that moment of suicide is really about the gun being right there.
Right. Right. It's the access. Yeah.
Yeah. And on my mom's death certificate and in the description of her death, it doesn't talk about bipolar. It doesn't talk about medication. It talks
Mhm.
about the gun.
Yeah.
Like my mom died by intraoral gunshot,
Mhm.
like
Yeah.
self-inflicted. She didn't
Right.
die of bipolar, you know. And I
Mhm.
think that when someone has a tool around them, like for example, let's say I have um, a new drill,
Sure.
I'm going to think, what am I going to drill with this new drill?
Yeah.
Whatever it is, and so the gun increases the idea. The gun
Mhm.
brings the idea.
Mhm.
I live with a gun in my house. I fought very hard to get my mom's property back from the police, and one of the
Sure.
items was the handgun that she killed herself with. And I I mean, no one's going to like that I do this, but I allow myself to have those feelings of,
Yeah.
okay, I'm in bed. I had a bad day. Like every time that gun comes into my mind,
Mhm.
and this isn't like I got a gun because I had a reason for a gun.
Yeah.
And actually, inheriting guns is a huge amount of the guns that people are
Yes.
ending up with.
Yep.
And that is another issue, and it is something that I've been building more conversations about. Like, can we create a system where people don't just land with a car full of guns,
Right.
and can it instead be processed through the will,
Mhm.
or through
Mhm.
a background check, or anything, or
Yeah.
even them
Anything.
giving permission that they even want these guns,
Right. Right.
um so yeah, inheriting guns is also a huge danger. And I mean, I hope that people will think about what that moment is, let's say responsible gun owners that love to collect guns. What happens when you die and your wife inherits 80
Mhm.
guns?
Right. Right.
What's the plan?
Mhm.
So like I said, I mean, I do like doing the work of legislation, but
Yeah.
I also see that there's every single level of policy change, even the policies within a family,
Mhm.
even the choices that
Mm.
individuals are making, how we operate around guns, how we converse about it. Because if, I mean, I saw this graphic one time from a suicide prevention organization, and
Mhm.
it was like a stick figure in the middle of a circle of other stick figures that were holding hands around them.
Okay.
So a bunch of people coming together around this
Person.
person.
Mhm. Mhm.
And I was like, wow, like what if I had a terminal illness,
Yeah.
and the major organizations that address this illness told me to get a circle of people to hold hands around me.
Right. Right.
you
Yeah.
know like
Mhm.
it is so we're so far, like all the people that are in this work are so far ahead of what the common understandings are around suicide in our country. And the myths are making it so hard for these changes to take place.
Right.
Like,
Mhm.
for example, I don't know that everyone really believes in suicide prevention. One of the criticisms I get all the time is, oh, they'll just do it another way. And so
Yeah.
it's like, if someone had cancer, would I be like, oh, they'll just go get another cancer if we treat this cancer,
That's such a good point. Yeah. Such a good point. And it's not true. I mean, the research shows that people who don't have access to their initial kind of means don't typically go on to substitute means.
Right.
So at
Yeah.
least, yeah. Mhm.
Yeah. Yeah, there's another myth that I was thinking that I wanted to bring up that bothers me, and is the myth of selfishness.
Mm.
And our society has created this sentiment that people that kill themselves are selfish.
Selfish, yeah.
And there are a lot of suicide prevention techniques that are pretty ancient that involve pretty much shaming the person into
Yeah.
not committing suicide.
Mhm.
But the truth is so much sadder. And the truth is that these people aren't selfish. These people feel that they are a burden to their families and
Yeah.
are trying to like relieve their families of them.
Mhm.
And that is such a sad thing. So I understand why people would rather not think about it. But these ideas that these selfish people are going to do it anyway,
Yeah.
are not helping. And so I think that if people believe in suicide prevention, then really believe in it. Really believe
Yeah.
that it's a real thing. We can prevent suicides. We can change society. We can
Mhm.
change Google. We can change the laws. We can change really anything that we put our minds to. And there is so much, this problem is such a sloppy problem that we have so much potential to fix it.
Oh my gosh, that's so true. That's actually really like simultaneously like very tragic and also really hopeful
Yeah.
because there is a lot of space. I totally agree with you. I totally agree. It is a sloppy problem. It's
Hmm.
and there I think is a lot of so much room for change. There's so much room
Hmm.
for change. And I do think that the more that we talk about it and we have these conversations, which is why your work is so important, the more that we talk about it and advocate for, you know, policies, whether it's a policy or it's a program change or whatever it is, the more these conversations are going to be, just part of our life. And I
Mm-hmm.
think the more that we're going to be able to make some of that change, and hopefully, move the needle a little bit, because it's
Yeah.
a vexing, sloppy problem.
Yeah. I mean, we know the solutions,
Right,
you
right.
know,
Mm-hmm.
it's just about implementation.
About implementation. Yeah. So I know we're getting close to the top of the hour, but I want to ask about that. So you've been successful, your work has been successful in implementing policy change in Washington, Utah, and Virginia. And what do you think has been kind of the recipe for success in those states?
Bipartisanship,
Okay.
having Republican support.
Okay. Yeah.
Yeah.
So it really is. I mean, I guess I was expecting like a really kind of complicated answer to that, but it's not, unless, yes. So bipartisanship, I mean, that is, makes perfect sense.
Mm-hmm.
And sometimes I think I was talking about this recently to some students that I was working with. We we often call suicide a very complex issue. And yet sometimes I think we hide behind that complexity.
Mm-hmm.
Um, because as you said, there are answers out there. We have to implement them. And this is a similar thing. It's about bipartisanship. It's about working across the aisle, and
Mm-hmm.
having Republicans and others on board.
I also wanted to add that the nobody who is in this profession is on my team.
Mm, mm,
Everyone who has any kind of occupational stake in anything to do with this
mhm.
seems to be threatened to lose their career standing in
Yeah.
order to support this.
Okay.
And I mean, if we're really trying to prevent suicide and we're just going to say, I don't think my boss wants me talking about this,
Yeah.
but the answers.
Right. Right.
like I mean, academia, the medical community, the police, the veterans, like, where are they? They're
Right.
all gag ordering themselves,
It's true. Yeah. Hmm.
and that is a huge problem. I
Yeah.
mean, like, I'm a parade producer, I'm a paper mache maker, I am a dancer.
Yeah.
Like, it shouldn't have to be me that does this, but I realize it's me that does this because I have nothing to lose.
Right.
And I have more to lose with this not happening.
Hmm.
Like, the
Yeah.
economic deflation of losing family members to suicide is more significant than the customers I'll lose by talking about it.
Right. Right. Yeah.
And it's very difficult to do this work without that community supporting
Yeah.
it. So I really encourage anyone who knows the answers to stand up and say the answers.
Yeah. Hmm. Yeah. Absolutely. Um, there's so much that we could talk about this. And I'm just so thankful that you reached out to me so that we could have a conversation about this, and, a really open and honest conversation. And I think we need to continue to challenge ourselves, to your point. Yeah, I think that oftentimes we get in our own way in a little bit of a way. And so I appreciate that call to, like I said, continue to challenge ourselves, continue to challenge the paradigms that we have seen for the last, many, many years that we've been looking at suicide and suicide prevention and thinking differently.
Mhm.
I just really appreciate that call for that kind of work.
And I hope people will see, like, wow, she did it. This, like, paper
Yeah,
mache Mardi Gras person. Like, imagine if I had, support from, like, JAMA or
yeah,
colleagues, or,
mhm,
if I was a psychiatrist, or
yeah,
really, I mean, anything. I feel like it, but then I see how people who really care and really know the problem, like, it breaks my heart that they're silenced because of essentially fear of losing their jobs.
Right. Yeah. Yeah, I want to spend some time talking about that a little bit more with you offline. So
Sure.
we'll keep this conversation rolling, Katrina. But if people are interested, listeners are interested, donnaslaw.com is the website go to. And certainly we'll make sure that that's linked in the notes with this episode so that folks can learn more. Yeah, and I'm feeling a little bit hopeful at the end of this conversation because of folks like you who are doing this work and the fact that there is opportunity for change. There's lots of opportunity for change. And so just really appreciate you being here with me today and having this conversation and being willing to share really openly about your experience. Because I really, really do strongly believe that folks like you who are willing to be brave and tell your story are going to be, the catalyst for change in our society as it relates to suicide. So thank you so much for being with us today.
You're welcome. It's also fun work. Like I get to meet like really cool people, and
Yeah.
now I'm hoping that I'll get to meet Cory Booker.
Oh my gosh, that would be
Yeah,
so
like
cool.
I have these little like legislative crushes now. So I encourage, it's not like all negative to like be in that work.
Totally.
It's really fun actually.
Yeah,
And
I
you
have
get to
academic crushes too, so I
yeah.
totally get it. That's awesome. That's
Yeah.
really good. Yeah, some of my favorite people work in suicide and suicide prevention spaces, and so and you're one of them.
Oh,
It was
thanks.
nice to meet you. Yeah. So donnaslaw.com for our listeners, please check it out. And if you're interested, reach out and we can connect you with Katrina and others who are doing this work. So thanks again, Katrina.
Thank you.
Just a reminder for listeners, if you are ever concerned about yourself or a loved one, you can dial or text 988, the National Suicide and Crisis Lifeline. You can also text the text crisis line, the Hope line, by texting the word talk to 741-741. And we will see you all next month for our next episode. Andrew and I will be coming together and talking about our own work, which is not something that we have ever done on this podcast. And so we will be having conversations about our research over the next couple of months, and we really hope that you tune in. Thanks, everybody.